Welcome to the 2026 CoC Plus program training. This presentation provides step-by-step instructions on using the Centene Clinical Action, or CCA portal to work the 2026 CoC Plus program. To access the CCA portal from the Centene Provider Portal, begin by opening the Centene Provider Portal and logging in using your existing credentials. Next, select Care and Risk Gaps Daily View under Useful Links. Finally, click on CoC Plus to navigate directly to the program dashboard. To access the CCA portal from the WellCare Provider Portal, log in to the WellCare portal. Hover over Resources, do not click. When the Centene Clinical Action application appears, select it. You'll then enter the health plan and TIN to open the CCA portal. To access the CCA portal from Availity Essentials, log in to your Availity account and complete two-step authentication. From the Availity homepage, hover over Payer Spaces and select your Centene or WellCare plan. Next, select Centene Clinical Action from the Applications menu. Choose the appropriate TIN from the organization drop-down and enter the NPI to launch the portal. The CCA dashboard contains quality HE-DIS performance data. Click on CoC Plus tab on the right to open the CoC Plus dashboard where you can view, manage, and submit appointment agendas. In the CoC Plus dashboard, use the patient search bar to quickly locate a specific patient. The selection bar allows you to choose risk or comprehensive insights. The notification dashboard, accessed through the bell icon, provides centralized access to downloadable reports. You can download agendas in PDF format by TIN, NPI, or individual patient. You can also download your patient list in an Excel report to help prioritize outreach. Filters can be applied to narrow your view and focus on specific data. To apply filters, click the filter icon at the top left of the CoC Plus dashboard. Filters include company, line of business, NPI, create date, risk status, comp status, and active agenda. The CoC Plus dashboard displays only active patients. Agendas are created under the provider's NPI. Imputed appointment agendas are created when patients see a provider outside of their assigned PCP tax ID, allowing those providers to assess and document conditions for CoC Plus compensation. Risk status and comp status reflect the submission and eligibility status of each agenda. Rank indicates patient prioritization based on a weighted scoring system. Assessed, unassessed, and assessed % show insight completion levels. To view a patient appointment agenda, enter the patient's name or member ID in the search field and select the patient. Click the member ID hyperlink to open the agenda. Agendas may be completed during the visit or afterward using the encounter as a guide. The appointment agenda includes patient demographics, a list of categorized patient insights, and last diagnosis reported for risk insights or supporting documentation for comprehensive insights. Select the appropriate choice from the provider response drop-down for each insight, then click Submit once all selections are complete. You will see the user who submitted the agenda and the submission date. For risk adjustment insights, select the appropriate provider response for each condition. All disease categories must be addressed and supported by a qualified visit and paid claim to be eligible for compensation. Status indicators include yellow for unassessed, light green for in progress, and dark green for assessed or coded through claims. When active and documented is selected, a corresponding ICD-10 code must be billed on a claim. Click the disease condition hyperlink to open the Risk Insight crosswalk. Claims must reflect a current program year date of service. Select Active and Documented when the diagnosis is confirmed and documented. Select Resolved or Not Present when the condition is no longer active. Choose Addressed Previously when resolved in a prior year. Select Patient Referred when further assessment is needed. For comprehensive insights, select the appropriate response for each insight. All insights require a response verified by a qualified visit. Yellow indicators show unassessed or compliant responses required, while dark green indicates assessed. For high-complexity insights, select the response that best reflects how the issue was addressed during the visit. Choose Active and Documented when unmanaged conditions are identified. Choose Resolved or Addressed Previously when no further action is needed. Choose Patient Referred when additional support is required. For quality insights, select Active and Documented when testing is completed or ordered. Choose Resolved or Addressed Previously when requirements are already met. Choose patient referred when testing must be completed externally. For clinical insights, responses should reflect how care coordination was addressed. Select active and documented when care updates occur. Choose resolved or addressed previously when no action is needed. Select patient referred when follow-up is required. Before submitting, ensure a provider response is selected for every insight. Click the blue Submit button to complete the agenda. Enter your name for attestation when prompted. Once submitted, risk and comp status will update to received. Any person in the practice working the CoC Plus program may sign and submit the agenda. To export appointment agendas, click the TIN, NPI, or patient icon. Open the notifications dashboard and select Download to save the PDF. The printable agenda includes member and provider details, signature, QR code, and insight responses. Agendas marked no bonus eligible or not eligible for CoC Plus incentives. There are 4 available responses for each insight listed on the appointment agenda. Completed agendas must be signed and returned using the dedicated CoC Plus fax number or secure email. To download the patient list, click the Excel icon, open the notifications dashboard, and download the report. The Patient tab shows patient ranking, patient demographics, and active agenda, as well as impute appointment agenda, TIN level information, and qualified visit information. In addition to insight completion percentages for active agendas. The Condition tab lists patient ranking and demographics. Patient insights are listed individually. CCA shows active agendas only for external users. Imputed appointment agendas can be viewed as well, in addition to provider responses, modification details, and assessment status. If you have questions, please reach out to your assigned specialist or email riskadjustment@arhealthwellness.com.